This is the state of the nation. Ibifa Uganda. We are deliberate, we are reasonable, we are uncensored. The state of the nation with Henry Ssali.
Good afternoon, good morning, good evening. Thank you so much for joining us today. My name is Henry Ssali, and I am privileged to serve you in this capacity. First, I would like to share a few things that have been happening in our various communities in Toronto. I want first and foremost to celebrate Mr. Chigozi, who just celebrated his 60th birthday. Happy birthday, brother. We love you, we honor you, and we celebrate you. In the same breath, I also want to send my sincere condolences to all folks who lost their loved ones, especially the people of Toronto who lost one of their own, Mr. Abbas Busulwa, who was laid to rest yesterday. And in that regard, I want to thank all the community members that have been there for him, especially throughout the last 2 months when he was in hospital at St. Joseph's Hospital. The different communities or community members that were working tirelessly to help his friends and family. Thank you so much for being there for both Mr. Abbas Busulwa, but also for the community at large. Shidi Rashid, kitalo nnyo ekya Muganda okufa, Muganda ate mukwano gwo. Na mwenna abamwetoolodde okusasira kwaffe okuteeka gye muli, abantu abalala bonna abafiiriddwa mu communities, waliwo bendabye abafiiriddwa bajjajjaabwe n'emikwano gyabwe, kitalo nnyo. Also, I want to congratulate the committee in Edmonton that has worked tirelessly okulaba nti no tuzaayo Vanessa eyatufaako wano, tumuzaayo Uganda. Thank you so much for that effort, but also thank you to the communities both in Toronto and Edmonton for working tirelessly, and Canada at large actually, working tirelessly to ensure that tuzaayo Vanessa Nankumba Uganda. Kusabibwa kwabaddeyo Joe Edmonton, for a few folks traveled there from Toronto. Era Nankumba's body is going to be taken back to Uganda ASAP, as soon as possible. What else do I want to talk about beside everything that is happening? Yeah, we have celebrated Mr. Chigozi. I have talked about abantu abafiiriddwa ab'enjawulo. Yeah. So with that in mind, I think I'm going to delve into our conversation. Today we are discussing what happens when elites govern. What really happens? Can local government councils work with governments or government programs to empower medical interns? This is an important conversation because we have been talking about it, really. We have been talking about it in different capacities. We have delved into what is happening at the central government level or the national level in regard to how interns are managed. So today, especially knowing that our colleague Solomon Serwanjja was declared chairman LC1, who won his opponent by 1 vote, an elite going back to the grassroots from the village level to grow institutions that help build our nation. So we want to interrogate the health care issue from the ground level, from the village level, So from village leadership to national healthcare reform. For the past several weeks, our national conversations have revolved around the rule of law, the treatment of political opponents, and the future of Uganda's democratic institutions. We have discussed the detention and health of Dr. Chiza Besigye. We have discussed the abduction and the eventual arrest of Lord Mayor Elias Lukwago, Lord Mayor Emeritus. And we have also discussed Honorable Mwanga Chivumbi's bail and rearrest, abduction and rearrest after he was granted bail. These conversations remind us that governance is ultimately measured by how institutions treat people, especially when they are most vulnerable. Today, we turn to another institution that touches every Ugandan, our healthcare system. Our question, even though has not been interrogated before, it's an important one. Can local councils become partners in strengthening Uganda's healthcare system by supporting medical interns from the village level? Because every doctor begins somewhere. Before the White Court, before going to Molago or Mengo, before opening up a clinic or operating in a theater, there was a village that nurtured them. There was a family. There was an LC1 chairperson who signed school forms in one way or another. There was also a primary school teacher who encouraged them, a community that believed in them. So if villages can nurture future doctors, can they also help retain some support to sustain them when they become doctors, especially in their formative years as doctors? Today, we ask whether Uganda has focused too much on governing from the center while overlooking the enormous potential that exists within local communities. As always, my colleague Stella Nyanzi has joined us here today, and she's with us. Dr. Mirembe is also trying to join us. Of course, he's having some troubles with the internet, but he's trying to join us as well. Of course, Chairman LC1 Serwanjja Solomon Sentebe Bamutakude is going to be joining us at the top of the hour because he's on the verge of traveling right now. So he's traveling to the airport. But this is an important conversation that I hope, even as you join us, you are going to share your thoughts in the comments so that we can understand how you know what's happening in the country and how you can participate in making it a vital conversation. So my friends, let me invite Dr. Stella Nyanzi to introduce herself. Also, Dr. Mirembe will be introducing himself thereafter. But first, Dr. Stella, how are you doing today, wherever you are? The week has been very interesting. In the last couple of days, we have seen what has happened in the courts of laws, judgments being shared virtually, and decisions being made in that regard as well. There's a lot that we are going to discuss, even though we are talking about how local governments can utilize some of the government initiatives or government programs to sustain medical interns at the village level. Dr. Stella, how are you doing today?
Right. Hi, Henry Ssali. Wonderful to be with you and to join Dr. Mirembe as well, who is in Uganda. I am well. It is as a Muganda, I suppose. I don't know if you talked about the Kabaka's coronation commemoration otukulisiza Abaganda oba weerabidde. One of the things I celebrate as a Muganda woman, although I'm in exile, is that we successfully had the Kabaka's coronation. It happened in a church. So, in terms of some of the interesting things happening, for me, it was interesting to see Baganda men in their kanzus and their back cloth, because one of the tenets of Chiganda culture is our spirituality, and the back cloth is very spiritual. So the back cloth was taken to a Pentecostal church, and it's interesting how advanced we are getting. But in terms of the week that has been, I think it's really important that we have Mirembe, because there have been very many health issues that have been raised in the courts of law, whether it's Arias Lukwago Salongo's denial of bail, or it's Honorable Muwanga Chivumbi's sending to prison, even on remand, even when he needs a scan to establish what happened to his head when he was hit during abduction, during the torture that he endured for the last, was it 19 days? Or whether it's Sam Mugumia, whom we've seen, terrible, terrible photographs, or if it's the right to health of suspects who are not yet uh, sentenced or convicted in court, in the case of Kizza Besigye, who passed out, and the questions about security men manning the ICU. We would maybe be asking, how come there is money to pay JAT to take big guns to the ICU at Mulago, but there's no money to pay interns? And so there are a number of questions around the right to health of political prisoners that have arisen. But how can we even discuss health reform to ensure the rights of political prisoners if our medical interns don't have basic pay? So these are important questions for me, Henry, and so I celebrate joining you as well as joining Chaimani. We were with him last week as he prepared for his elections. I was shocked that he won by only one, according to the law governing local LC1 elections. I think if his opponent had counsel that if the difference between the winner and the person that follows him is below a particular mark, there is a possibility for asking for a recount. So, if when Solomon comes, I would want to congratulate him for that very tight win. And that is how I am. I look forward to learning from Dr. Mirembe and Chairman Serwanjja in today's session. Thanks for holding the space.
Thank you so much, Dr. Stella, for joining us and for sharing those sentiments that you have shared. Thank you also for correcting me for not celebrating my Kabaka n'omusajja Muganda. In fact, nabadde ndowooza kwambala kanzu naye simanyi bwe ndinzaako nga sijjambadde. But badde sharing ano nga waliwo ekintu ekyeneebuuza what haven't I shared? And incidentally, that's the only item that I don't have on my list to acknowledge. Naye nga tuyozayoza Ssaabasajja wa Buganda atudde ku Namulondo emyaka 33, njozayoza Abaganda mwenna n'abakulembeze mu Buganda. Very interesting dynamic that we celebrated this anniversary at a church setting. Of course, there are some opinions and ideas on how that unfolded and what it means for the future of celebrating a cultural celebration in a church setting. These are all conversations that we can delve into later, but the most important thing is to celebrate Buganda, the Kabaka, and our culture in that regard. Dr. Mirembe, how are you doing? How are things going with you? And are you excited to be here today? Are you muted, Dr. Mirembe?
Oh, let me see. No, I'm
No,
not.
we hear you.
Are you
We
able
hear
to
you,
hear
yeah.
me?
Yeah, we do hear you.
Okay,
Yes.
thank you very much. Um, I don't know where to start from, but I should start by congratulating every Muganda, wherever you are, and you're proud of your heritage. Congratulations that our leadership is now 33 years and counting. And for me, as I'm old. I don't know. I call myself young. But when I compare myself with Dr. Stella, then I am young. But I'm old. I'm a father of 3 biological children, with 4 non-biological children, with a lot of responsibilities at a personal level and a community level. So abamu twakula tukyali bato. But you talked about the council. I had to go because I'm a born again Christian. Have prayed from that very Watoto church, but somehow on that day I was very weak, so I could not actually leave home. And the most unfortunate part, I said I'm going to be glued on BBS Telefina. Power went for the entire day until when the function ended. It was very annoying, but I'm grateful. The function went well, and it crossed to the boundary where it was celebrated from. There is a lot to learn from that particular gesture, and I think actually I want to propose, if not next week or another week after preparation, we should be able to discuss the relevance of the traditional leadership that we had before colonialists came, and the past, the present, maybe the future. What is the impact of that kind of leadership? Because for me, I'm seeing a lot of impact from Uganda Kingdom communally than even in the 40-year-old regime, when you base on the input versus output. We give them a lot of taxes annually. Uganda, you'll see, I usually give 100,000 for my Luwalo. But this government takes away more than 500,000, I think, every month in my earnings. Yeah, around 500,000. But then everything, including my security, it is in fact the government is hunting me down, is making me insecure. So, you know. But anyway, I'm very grateful for today's topic. As we start, I pray the chairman actually shows up, because I think it's a very important topic for the community, especially the very vulnerable people on the ground. Yeah, thank you very much. And Dr. Stella, nice to meet you again. I hope we have a very good debate and conversation.
I'm sure we are going to have a very interesting and rewarding conversation. And before you actually leave the stage, Dr. Mirembe, I'm going to start with you. Every doctor, every medical doctor begins life in a village or neighborhood. I want you to tell us, looking back at your own journey, how important was your local community in shaping your decision to study medicine? And are villages doing enough
Yeah,
to
very.
encourage young people into healthcare careers? Dr. Mirembe.
Yeah, one, You asked, our village is doing enough to encourage young people and individuals to join the healthcare sector in terms of service. That doing enough needs to be contextualized. There is doing
Well, yeah.
enough
First,
by wishing.
I think
Then
first you should
there
tell
is
us.
doing enough.
Yeah.
Yes, I'm going to come there. I just wanted to
Okay.
broaden the
Okay.
thinking.
Okay. Okay.
Doing enough by wishing, doing enough by providing the resources, the environment that enables you to really. But anyway, going back to the question, how there was a break in your voice, but I picked that. How did I decide literally to get into? So for me, it was a purely community thing. Yeah, of course, I grew up thinking, being told doctors are very respected people. A doctor is a doctor, engineers, and other kind of professions. But on one of the days, someone graduated with a diploma in ultrasound from the village. And there was a very big celebration. The entire village, the entire 4 parishes, were at Mzee Garwango's home. And this old man, who was the father, happened to be like my grandfather. So it was, I'm like, ng'abasoma babasanyukira nnyo. I was like, I think in P3, P4, around there. So I'm like, I also have to study, and I do a party. And particularly be Musawo, because in the village, every health worker is a doctor. But what made the real change, because as I grew up, now I'm in secondary, I understood better, more knowledge. I probably wanted to be an engineer somewhere because I was doing sciences, I was good at them, I can tell you. So my father got sick, and I was sent home to collect school fees. 100,000 was the only money I was paying by that time in senior six. But I had not paid the money, and I was chased. When I reached home, my mother told me she had collected, I think, 65,000. So that one was available. Sick, was taken into a hospital, and the money had been spent there in the hospital. So I went to see my father, and in the hospital there was very poor care. The man had not been worked on an entire day. Had been admitted the earlier day, but the entire day after had not been worked on, that the doctor had not yet arrived. And I kept there. The first person died in the ward. I will not mention the hospital, but it's in my constituency. The second person died. The third person died in that same ward. So I was very traumatized. I was really badly beaten. Then I'm like, I think we have very few doctors. So I made a decision that now, because that's actually, you can be a doctor and even still fail to serve your people when you have the knowledge, but the resources, the enabling environment crack down on you. And actually, up to now, I've really admired to be deployed and work in a Okota amongst my people, but I've not got the opportunity. I tried to almost set up my own facility, but then because I entered politics, people wanted free things, and it would still vulgarize that I would need a lot of capital, to set up the hospital, give services at a very low price, something I've not afforded. But if actually I was deployed by government to work in my village, I would happily go there and work on my people because they really need the services. So the enabling part, I think the villages have done good on wishing, but they have not done well at all on addressing the factors that implement the wish. Looking at something like, for example, taking children to school is a very big issue. You look at a village and the dropout rate from school, those who start primary 1 to finish P7, you reach a dropout rate is like 95%. And some of these what I'm saying has been supported by the government statistics itself. When you reach senior 1, senior 4, my God, it is very terrible. Some of us actually don't see our schoolmates at primary, at secondary, anywhere above seniors. We are not seeing them. I'm not saying that they should have studied medicine, but even in other courses, in law, in teaching, in humanities, in social science, they are not there. Where did they go? They ended up either teen pregnancy, fishing, whereby now they have been chased from the fish, from the lake. So fishing is now for actually the rich and the connected. Some are doing farming, struggling a lot with farming because we are not seeing breakthroughs of many of them. You see 1 or 2. So, and others have gone to Saudi Arabia and other countries to try to look for survival. So have the villages done well? No. The resources have not been provided. Of course, now the resource envelope goes back to question the governance structures, whether they are enabling the parent, they have given the parent enough knowledge, then enough enabling environment for them to conduct income generating activities, take care of their children. Then for those areas where there are government schools, are they real schools or they are just political accountability buildings and a few skeleton of staff? Then you see Baram goes there, says, you teacher, you have not been here for 5 days. But a teacher should not be at school for 5 days ideally. Why? Has to prepare materials that they are going to use to teach every week. So a teacher can decide to prepare the material from home. The teacher has to mark books and assignments. The teacher has to prepare projects. It is the competence-based curriculum. Some of the things are not going to be done at school. Then the teacher comes to school to implement. And this is not new. It's not new that. So then this same person is saying parents should not pay PTA fees. But the government is providing less than 10,000 per child, per term, maybe. Money that can't do anything. The parents are coming under PTA to sponsor more teachers, sponsor more resources to ensure that their kids can learn. Then someone whose son studies at a school which pays 5 million per term comes and tells you don't pay 10,000, don't pay 60,000. Why don't such people come also and teach their students or their children in these poor schools, which don't have the basic of the basic facilities? You know, we are going digital, and these schools don't have internet. They don't have computers. They don't have routers, even for teachers. Even teachers can't access fair internet. Instead of addressing key problems, they are addressing politics. Me, I think actually the Baram Namere campaign is a deliberate, crafted campaign by the NRM to sanitize and make people forget about the atrocities committed against people, to start early campaign such that by the time they reach the 2031 election, there will be some semblance of, we have been working, and they are doing it as allies. That's my thinking about that caravan, because for me, whatever they are doing, as UMA, we have done it for the healthcare sector. We have exposed this, we have written about this, we have met Museveni about this, met the ministers, told them, they even avoid us, they no longer want to meet us because we have told them the right things to do, basing on their own even data, their own analysis. So that's what I can say for now.
Well, thank you so much again, Dr. Mirembe, for sharing your thoughts regarding that. Dr. Stella, you and you seem to have a similar trajectory. Your father was a doctor himself. There are some inspirations, I think, that you can share regarding how he became a doctor. I don't know.
My father is a peasant farmer who refused to go to school when he had the fees, and he decided to trade in Ikase. and he got the money, but then the money disappeared completely.
Right.
Yeah.
Well, Dr. Stella. Yeah, Dr. Stella.
Right.
Public,
So
yeah, public health, public
maybe
health
yeah,
vision.
maybe in terms of background and all of that, when I was listening to Joel's story, and yes, my father was a medical doctor. He died after retiring from years of service as a doctor. His last post was as he was no longer working in the clinic, so he'd graduated to administration. He was the last MD, director of Mengo Hospital, and then he retired. Oh, and then he went home and he died
Wow.
looking for medicine. But in terms of your question, when Dr. Mirembe was speaking, I thought about especially the ratio in terms of statistics. The vast majority of Ugandans, at least 90% from our censuses, live in rural areas. And I think in terms of statistics, the vast majority of medical doctors, 70%, sometimes the figures are even higher, are based within cities. Yeah. So, and remember that one of the spaces we had with Dr. Mirembe, we talked about the doctor-patient ratio of 1 doctor to 25,000 patients in Uganda, although the World Health Organization recommendation is 1 doctor to 1,000 patients, right? So most Ugandans live in villages or rural areas. Most doctors who are overworked are based in cities and towns. And I think, therefore, in terms of inspiration to work, what I already see is that many everyday young doctors maybe get inspiration from this gap. I don't know. Because their family members, their carers, their patient, their neighbors in the villages have to go and wait. There's a long wait time, as Joel explained. There are probably deaths as well. When you sit in these health centers or hospitals, you observe people dying because of understaffed, under-equipped hospitals and health centers. And I think for me that the experiences, I've been with many activists, younger activists in Uganda who are in the anti-corruption campaigns, and many of them talked about experiencing dire health circumstances for their family members, watching a father struggle with illness amidst having no money, and then failing because they had to wait for a specialist. So I was talking about 1 to 25,000 in terms of specialists. Now, urologists, gynecologists, the ratio is even much worse. I mean, Joel can tell us. So in terms of the community, the local community,
We need to have no specialists.
tell us.
We need to have no specialists because we literally have no specialists because staffing gap for specialists is at 95%. Like 95% of government hospitals where they are supposed to be specialists, there is a zero in terms of numbers. And this is Ministry of Health data that I'm using. I'm not using my own even research. These are official records of Ministry of Health.
Right. So I was using WHO statistics, which is sort of, for me, it's the easiest place to go to. But yeah, thank you again for emphasizing my point. So in terms of what happens in the villages where, if your father, if your family member needs access to immediate health care, 1 to 25,000. In terms of access to a specialist, if they're referred, that hernia or that, I don't know, that kidney needs surgery, you need a specialist for that. Ministry of Health is telling us the gap is at 95%. So in terms of care, therefore, the bulk of it is happening at the local government level. At the LC1 level, that's where patients and patient care, especially in our communal rural areas or our small trading centers which don't qualify to be towns and don't have a health center, the healthcare begins at the local grassroots, the village. And I think for me, that how communities then inspire young people into medicine is an important question. The workload, the patients, the illness, the burden of disease, the healthcare overload. And I think to that, for me, I would add things like alternative medicine. Yeah? That it's in the villages at local grassroots where traditional birth attendants replace antenatal care. So people drink okunywa eddagala nga balinywera mu budomola mu kifo ky'okunywa eddagala ku antenatal happens. Abamagumba, there are those in Uganda, we have those bond setters who tell you kumacha ojja kutuula wansi. You know, you sit out in the morning and the winds will set your bonds. And so in terms of, you know, orthopedic care or whatever it is, that people then revert to the herbalist and the traditional healer. And that is also managed at the local government level. In terms of pharmacies and buying drugs, you know, I've been following contraception, contraceptives, family planning program that was introduced, where women are being encouraged to go and get contraception from village health centers, and the difficulty of doing that. And then in order to have contraceptives, they turn again to local everyday herbal remedies that may, you know, are not based in science. And so I think that the decision therefore to manage health, especially for poorer Ugandans, forget about those who can access private healthcare, forget about urban-based city dwellers who have several options to choose from, that for everyday citizens, the management of health care based on very low incomes happens at the LC1 village level. And so how doctors are inspired, for me, is a question that's important, and how communities support them is a question that's important. I have heard from Dr. Mirembe being inspired by the experiences he witnessed. But in terms of what a village can do in terms of grooming our healthcare providers, that the gap is already apparent. The need is so big. And so perhaps the question then for people like Chairman LC1 Serwanjja is how to match this need in terms of planning, the plan. If we leave alone what Dr. Mirembe called the caravan of Balaam and Namere, if one was going to intervene in appropriate ways, I think that some of these solutions are going to start from the very village LC1 level, finding homegrown solutions to this challenge. So I haven't addressed the question of the workers themselves, the frontline workers, but what I'm saying is that these statistics, when you unpack them and say there's one doctor to 25,000 Ugandans, what does it mean at LC1 level? Because we come from the LC1 village level before we end up in a hospital bed, before we stand in the line in the clinic. We belong to some village. Our illnesses are recognized, identified, the symptoms, we get them, we fall sick in our beds, our temperatures rise up in a village, all of us in a village, and LC1 somewhere in Uganda. So the commute from the burden which we take to the healthcare workers comes from the LC1 to the health center, if there's one, or to the hospital. Sometimes the hospitals are for referral, but many times people come from the village straight to the hospital. So there's a question there in terms of management and how local government can intervene, especially if local government is going to be LC1 chairperson, such as Solomon Serwanjja. I don't know if we have utilized this enough. And maybe I will end on one point to say that I know about village health teams. I don't know how effective these are. If the LC1 chairman is not remunerated, what about the village health team worker? I remember that when I lived in Kampala, we used to have this bed net, mosquito bed net rollout things. And when I was a secretary for our LC1 in Bulindo, there was a call for distributing bed nets. And the LC1 at our level WhatsApped people about, we have bed nets, we're giving, I think they were giving 4 per household, but at least there was a distribution campaign. And we didn't have a VHT, we didn't have a village health team, but our LC1 chairman mobilized houses were going to get and the distribution itself. I also remember that there's a time we used to spray. There was a pump, a bomba nga twafuiranga bikisijjukira. But we used to spray, and that is about prevention and cure, and maybe it taps into the Bulungi Bwansi drives that we used to have previously, and the DHOs. We used to have, there's a time, long time ago, maybe in the when my father was an long time ago, he was a DMO, district medical officer, and these district medical officers would have these drives, and again, that's again in terms of managing the health services from the district level. How effectively are we using the models that we have as a country? I don't think we have. I think that the LC1 generally has been left to sign the witness system, processes of selling land or buying land, and to have that stamp when somebody needs a visa or a passport, and not much has, in terms of health management, is being handled at the LC1 level. But that's me thinking here from Germany, and also thinking from memory. I don't think we're utilizing our villages well enough, but I may need to be corrected by Dr. Mirembe, who has managed as Secretary General whole medical association.
Well, this is very interesting and amazing that you're pulling out some of those snippets from your memory, but also from what you have seen happen in our communities. I think you rightly say that we get sick from our households, from our villages. Those are the immediate administrators that are responsible for our sickness. Right?
And also when we die from those hospitals, we are sent back to the villages. So if the health workers are not working well, if the health management is not managing our illnesses well enough, Ebola, COVID,
and I think that's very important that we are having this conversation. How can the village level administrators manage healthcare from the grassroots to the central government? Because what I have seen Dr. Mirembe do, and most of the other interns, that are what they have been doing is going to parliament, right, to legislate their remunerations, right? Mutuwe remuneration, give us remuneration, because what we are doing is important. They think what they are doing is important to the country, but really what they are doing is important to individual villages, right? To individual villages, because we get sick from our homes. From our home, you go to the village center clinic, and that's where healthcare is managed first and foremost before you are sent to a referral hospital, either in Mulago or to a private hospital in IHK. So, government often treats. So I think what is happening is that also government often treats healthcare as something delivered from Kampala. But perhaps healthcare should also be built from below. And I think this is important because at the village level is where we interrogate, we intersect, we interact with some of the biggest sicknesses, including Ebola COVID-19, when it happened, it started from the village level. Wabagambira togenda kuziika ku kyalo kubanga omuntu oba ogenza okuziika mulina kubeera bwe muti, who monitors that, right? So Dr. Mirembe, if every district intentionally invested in future doctors, how different would Uganda's healthcare system look like in 20 years from now?
Thank you very much. That's a very big and a bold statement. But such a practice or a proposal would work when you have real practical decentralization, whereby districts really have the power in collecting the revenue and utilizing the revenue to develop those particular areas. Their resource envelope depends on the central government's priorities and wishes. So it becomes a little hard. One, they may groom doctors, but will they be able to absorb them into their system to work? That's another question. I've told you I was born, raised in Maokota, Mpiji. My great grandfather was born and raised here in Busiro, Buaya, and so many of them, they are all rested there. So I would be happy to work in either of the areas, and I would be passionate because whether in Busiro or in Mpiji, I would passionately be working on my own people because I'm attached, I have that personal attachment to them. But where are the resources? A healthcare system can only function right when healthcare can only be right when the healthcare system providing it also is healthy. Healthcare system has got what we call pillars, ranging from governance, the right governance. That's very pivotal. Then we will bring in the infrastructure, we bring in the funding, we bring in the medicine and the supplies, we bring in the data management and utilization after you collect the data. Do you use it to make a decision or you collect it just for just? Then the people who it is going to serve. And these people are at different categories. They have from different backgrounds, different communities. So the system should be able to recognize the uniqueness of every community and craft responsible solutions that will be accepted first. Because even if you bring state of health care, if people don't accept it, I can tell you it will not work because no one will take it in. So the uptake of the health care, we have had very big challenges of uptake of antenatal care services, shifting mindset from Mulerwa or traditional birth attendants to coming to hospital to seek care 8 times before you deliver. The first thing was 3 times. Now the recommendation of World Health Organization is 8. But I can tell you, even learned, educated people don't come 8 times. You find an educated woman, even rich, she's 6 months pregnant. She has never seen a health worker. She has never done a scan, never done anything. Then you ask, what were you doing? And she begins to explain. Then when you dig deeper, somewhere in the family, they have a rule that when you go to Musao before 6 months, the child will die or get issues. So you have to understand first that. Then you teach patiently these communities how to overcome some of the myth and superstition. But when for you just come and blame them, trouble. You get it? Trouble will just really pick you up. So the proposal is very good. And me, I believe that's why me, I would love that we get this Uganda federated into at least like even 10 states or 13 states, the original states, such that we can begin to work on our own problems. The Uganda Kingdom is constructing hospitals, a very good initiative. I can tell you, I've visited the hospital they constructed in Singo. It's a health center but if it was a government facility, it would be like a general hospital. The infrastructure there is very good. But the kingdom doesn't have enough taxes to deploy enough staff. To deploy, it has constructed the building, it has put in some X-ray, some ultrasound, but the human resource for health there is not in. The Uganda children are available, but who is going to pay them? Then, where the hospital was constructed, if you put user fees that are able to be used to recruit staff, will the people afford? No. Is Uganda Kingdom collecting taxes from that particular catchment area such that it can support the schools it is starting, because it is even also starting primary schools and kindergarten schools in these areas. Every category has at least Lina kindergarten school here Uganda. But we do not want one school. The schools should be at a sub-county level. Uganda Kingdom was collecting, and a good percentage of taxes going to it would be really far, would be having internet, would be having our children accessing computers. But me, Mirembe, I would be in a single treating people there because I have the qualifications and very qualified. Then, if not in a single, I would be probably supporting the efforts for the kingdom to start a hospital in Maokota, such that I can be able to treat my people and encourage other young people to take up. Because when you're treating your own people, you will not be probably asking for the very high pays, because you will be able to settle. You will construct your own house there. You will be carrying out maybe your agriculture or your other business there as you serve your people. But then here you are thrown in Karamoja where you don't have even any attachment to settle. You don't actually want to settle there. So you keep running in between Karamoja and Maokota. I'm just giving an example. And in 10 years down the road, nothing. You have progressed because you're spending a lot of money in transport, risk, road carnage is very high, among other things. So federation, whereby taxes in particular, federation with resources, not these political things of federation without resources, is the way to go. And it would go a long way to develop local talent in terms of human capital development, utilize those talent. Then if we have excess talent, export it to those other people who don't have it. Train very highly trained people, good curriculum, such that you can even export trained people. These things of exporting our sisters into the Saudi Arabia, Qatar, Dubai, when they don't have skills, is hogwash. It should stop. But we can't stop it unless we first provide a platform that is equitable for them to train and get their skills. Then they can go and market the skills, bring back foreign exchange to Uganda, and we develop further for us who are still here. So for me, I want also to put this. Health is not just going to hospital and get Panadol and get a surgery. The World Health Organization defines healthcare as it is, I will skip all the others and say, not merely absence of a disease. You must be psychologically healthy, economically healthy, socially healthy. If those three actually are not settled, you are not healthy. You are a sick person moving around, according to a global definition. Here, we think when you are not going to the hospital to be operated on or to get malaria treatment, then you are healthy. No, actually, that's why if someone did a survey with a very strict definition of healthy people in Uganda, a representative survey, you'll find like 50%, I think, of Ugandans are sick and they need to be attended to. You get? Maybe actually the leaders of this country, I think, are sick. That's why everything is being run almost upside down. You get it? You know? So I think that's why, because they are sick, that's why you saw that you are in court, someone collapses by international standards. Even someone who has never gone to school, never been educated anywhere, would know that that person needs a doctor, because being a doctor didn't start today. It was there thousands of years ago, decades, centuries ago. Would think that they would call for a doctor in the nearest or a nurse, anyone who knows a thing or two about health. In that court, there was a blood relative of retired Colonel Dr. Kizza Besigye. The judge, the prison, stopped the blood relative from helping save the life of Dr. Besigye. There were two other celebrated senior doctors. Dr. Kamara left public service when he's a senior consultant. Dr. Lulume Baiga runs a medical facility. He practices himself. I've visited him myself at that facility. They were in court. They were not allowed to save the life of a doctor in the first place, who gave his own life for this country, for the goons that are after him, actually. But that, for me, Maguma making such a decision is not healthy. Prison authorities making such a decision, they are not healthy. They need to be helped, because psychologically, socially, maybe they are on some kind of pressure. They are not healthy themselves. So health expands to that kind of level. And if people don't care on camera, not to disregard, if they don't care to the level that they can violate the health rights of retired Colonel Kizza Besigye, are you sure they care that my grandmother in Bugeye village in Kozi, my grandfather, who is in Isingo, battling prostate cancer, do they mind that actually they should be saved if they did it on camera? And they have even stopped all of us from visiting Colonel Kizza Besigye. There are over 50 uniformed men deployed to guard the doors entering the ward, the level of the ward where Kizza Besigye is, and services have been paralyzed because most of them have been closed. But who is suffering from the paralyzed services? The common people who are not going to be worked on. You get it? The common people who are psychologically tortured by the excess presence of military, prison. But remember, they are also ununiformed men. So if someone turns a national referral into some kind of a police station, a barracks, because one person is arrested there, do they care about our healthcare system in the village? Let me also say this. At the village level, according to ministry structure, we are supposed to have there a village health team of personnel. Previously, these were whoever, even if you are not educated, as long as you're a goodwill person. Now they are trying to replace those ones with the community health workers. These are at the level of senior 4 dropouts who have not done anything about medicine, but they are given 2 weeks training on healthcare delivery, 2 to 3 weeks training. And you keep wondering, Uganda has enough nurses at a certificate level because that is supposed to be the health center 1. And we have proposed as UMA 5 years ago, and every year we keep reoccurring that the certificate nurses should be made the health center 1 facility. Every village should have a well-trained certificate nurse to manage the common ailments at the village level. Why? These community health workers, they are giving drugs like malaria and some other drugs. They are misusing the drugs and they are causing development of resistance to these medicines because they are giving them even when they are not supposed to give them. They are underdoses. They are giving overdoses, and no one is caring actually to do research to document these things. But we are seeing them every day. And recently, Uganda is developing a lot of resistance to antimalarials. Why? These drugs are being misused at the village level. So the question is, does the village leadership matter? A lot. It should be able, it should be trained, it should be qualified to advocate, to push for such an agenda that no, instead of a senior for dropout who knows nothing, we want a nurse. You get to take care of our lives. We have our son or daughter is a trained certificate nurse, should be the one to be the community health worker. Government should pay this person a salary. You get it? Then health center 2 level. There are a particular level of health workers who are supposed to be there, not doctors, of course. Health 3. Recently, we pushed for some Uganda Medical Association that government should deploy at least 2 doctors at the health center 3 level. And they passed it, public service passed it. It was put into public service structure. Actually, currently, we are supposed to have a medical doctor trained at health center 3. But I can tell you this government has only deployed some medical doctors at center 3 in Western Uganda. The rest of the areas are struggling. And
Right.
no deployments are happening. We have enough doctors to deploy at that level as a country. And most of them are now moving out of the country because they are tired of miserable working conditions, miserable pay in the private sector, miserable everything. But these young people, well trained, qualified, could be deployed to critical mahjongs.
Right. I'm going to Dr. Mirembe.
Is very important because identify.
Dr. Mirembe, do you hear me?
Yes.
Yeah, I'm going to delve into that question now.
Yes, I'm hearing you, sir.
I'm going to delve into that question next, but before we go into that question, I want to give Dr. Stella an opportunity to respond to what you have said, but also to think about what Chris is talking about here. So Chris is saying here that the manner in which Minister Balaam is bullying healthcare providers and subjecting them to mob justice, like we saw or like we see in Bulambuli, like we see in Bulambuli. Time will come when villagers don't have these professionals at all. I know that up to now, the health officer for Bulambuli, Dr. Molongo, had been denied bail and is still in jail in Luzira prison over a 7 million shilling toilet, which was mismanaged by a contractor. Dr. Stella, Dr. Mirembe has been talking about federating healthcare. And before we delve into interns and how interns should be treated at the village level and how they should be distributed, your thoughts about both what Dr. Mirembe said, but also what Chris is talking about here, specifically what is transpiring in Uganda today.
Right. So in terms of responding to Dr. Mirembe, he said a lot of important, interesting things. I think the question of the federation, as a Muganda, I'm torn, because as a Muganda, I'd say, of course, bring it back, because we are at an advantage, the central region of Uganda. And I think that a lot of that is built around Buganda Kingdom, which was celebrating its 33 years of coronation since Museveni, returned Byoya Byanswa to us, right? as a Ugandan nationalist, if I was thinking about the country, and this is part of my problematic colonial, my colonized mind still aspires towards the Ugandan nation. That is sort of my primary identity. Yes, I'm a Muganda. As a Ugandan, I would say no to federating healthcare, to decentralizing resources down to that level of the federal state. As a Muganda, I'd say yes. And I'll tell you my conflict very quickly. In terms of healthcare provision, I think because of the way that colonization worked, Buganda was among, we were the administrators of the Queen. We did the dirty work of the Queen on behalf of Imperial British East African Company. And so one finds that all the hospitals of note in the country are centralized in Buganda, in the central region. Mengo, Chibuli, Rubaga, Zambia, Entebbe, grade B, almost, Butabika for mental illness, Cancer Institute, UVRI, Uganda Virus Research Institute, which does all the research a lot of the research that we need. The original missionary hospitals, did I mention Chibuli? Whether they were Protestant, Roman Catholic, or Muslim, are concentrated in what would be the central region federal state. Now we have Lacho, we have Mbarara, we have Iganga, we have Jinja Hospital, we have some of those district or regional referral hospitals. But I think in terms of concentration of healthcare services, where are the teaching universities? The majority are still concentrated in Buganda. And so as a Muganda, I'd say, hey, give us a federal, let us have the federated state. And as Dr. Mirembe said, when we have a surplus, we shall send you some, After all, we'll first take care of our federal state. And if you're in a new region, like I don't know which one, then there'd be problems. Some of the older federal states, which did not have centralized power, they didn't have a kingdom, and they had chieftaincies, or there were some, segmented, decentralized communities with chiefs or clan leaders, or God knows whatever organizing they had. It would be very difficult to find historical organizing around healthcare, although they must have had something. And so, as a Ugandan national, the colonized Ugandan Stella, I struggle to support federal because of the inequality of distribution, which is historical. It's a colonial problem we inherited. It's part of our legacy. As Nyanzi, Mwala wa Nyanzi, eyaddira embogo, right? I'd say, of course.
Let me push back. Let me push you back. Let me push back on that.
Yes. But then I want to say that out front, because I've had a number of many of the elite Ugandans that I know tend to be Baganda men, not even the women. And many of them, whether it's an engineer, he says, hey, but where we are fair, or like the builders have issues, the landowners have, and Baganda men are already sorted. They know what to do. Federal, give us federal. We are already organized. But yes, I want to hear your pushback.
Yeah. So the pushback is really about not necessarily about me, but about someone who would say that Buganda right now is the most densely populated region in Uganda, and it does not accommodate only Baganda. Most of the people who live in Buganda are actually non-Baganda. I would argue that most Baganda actually live abroad, right? So the beneficiaries of that federation, if it happened, wouldn't be mostly Baganda. It would be the Eritreans that live there, the Somalis that live there, the Rwandese that live there, all the other tribes that live in Buganda right now. So when you argue that federation is not important right now because it benefits Buganda, it's also a paradox, because most people who live in Buganda are not Baganda right now. What would you say to someone who says, who rebuttals your approach to federation right now?
Okay, so I mean, I would want to listen to the Muganda man who believes in federal and proposed that we decentralize and we federate healthcare services. But in terms of your question, so in terms of Uganda kingdom, our kingdom is first of all the people who you're talking about, but it's also the land and the infrastructure and this resource. Abaganda twemalirira, okay, and I say that very proudly, and other people say, But here's the thing that in terms of federal, central region, okay, and we just do the geography, we do the administrative organs of the states, the federal state. So we maybe have central region, which has Buganda, and that is, and when I mentioned Rubaga, Mengo, Mulago, Chibuli, Butabika, Kosu Eyamagumba, the one that does orthopedic care, almost all the specialized care has concentration again in the surface area that would form the central region federal state. And again, as a Muganda, I'd say, yeah, mobility. If an Eritrean has it, Buganda has it, right? Whether it's in Masaka hospital, Fetuina, Abaganda, okay? And maybe the cities have, some Acholi, some Basoga, but at the end of the day, in terms of regional development, I think that we already have a lot of infrastructure relative to others, right? And in terms of revenues, therefore, I think that if we were given federal as Buganda and not just the cultural organ, we had our own tax system, we had revenue collecting system, we would give to the Kabaka willingly. I heard that just the church before Museveni gave anything in terms of offerings to the Kabaka's ceremony, there was up to, was it 30 million or 40 million? I think the church collected 38 million and Nabanja added 2 million and we got 40, or they collected 28 and Nabanja added 2 million and we got 30. But whatever it was, in just one event, we were able to collect money. So I in terms of mass, forget about the Baganda, the people, but we are also, the people of Buganda are also in Buganda, although we are also elsewhere. I think what I was referring to is which federal state would be at advantage, would be more advantageous. And then if the tax remittances that were going back to the federal states depended on who was giving more, again, I would say because of the concentration of industry and private sector and development, that the vast majority perhaps would come from Uganda, Central region, maybe Western region as well, given the current politics. But I think that there's a historical imbalance that favors the Central region, which is mainly Buganda Kingdom concentrate. But
before you complete, this gentleman here, Chris Namakola, is a Mugishu, and he's referring to his village in Bulambuli, right? And he's telling you that, the doctors there in Bulambuli, I'm assuming even the doctor is referring to is a Mugishu as well, passionate to work on his people, but now being disrupted by central government because of what they are doing currently right now. And I'm happy to say that the chairman for Bamuta Kude is here as well. So he's going to be telling us what his vision is for Bamuta Kude. But I want you to complete your thoughts regarding the idea that Dr. Mirembe talked about, the idea that he would be very enthusiastic or excited about working on his people in his regions, whether where his father was born or where he lives right now, and cross-examine that with what Chris Namakola is talking about and your idea of federalism, the conflict that you have between Uganda and Uganda, but also what we are discussing about building institutions from the ground up. Because when we are building institutions from the ground up, even when we are not federated, we are literally encouraging people to go back to their villages. So to build elites who are in Kampala right now, who think that governance should start at Parliament of Uganda, when they can actually do better governance or leadership at the village level. What you're going to see is that we are going to be implementing federalism implicitly, even when it's not legislated.
Okay, so to cut my answer brief, since Solomon has come, and I would also want to hear from Dr. Mirembe about, this Baganda bepanka akepanko kafenga Baganda vis-a-vis the Ugandan nation state. I think for me it's a debate that's enduring, the Buganda question within Uganda, and we'll talk about federating healthcare services or other services. That question for me always leaves me conflicted. But about Bulambuli, I think it's important to address the Balam question, and maybe this is the wrong forum. Dr. Mirembe invited us to talk about Buganda today vis-a-vis Buganda as we got, as it was given to us in the 1900 agreement. Before the 1900 agreement, and that's an important question. Another important question for me would be what the circus, he called it a caravan, I call it a circus, what the circus of Balam and Namere represents. And I think for me, the more pertinent question is why educated, conscious Ugandans are turning towards Balam and Namere for solutions, or others are turning towards Muhozi for solutions. Why have those become the new pillars of resolving our governance deficiencies? That's a worrying one. In terms of Bulambuli, in terms of what Balam and Namere are doing, I think it is treating a malignant cancer with kofta. Kofta. Not even paracetamol or ibuprofen, but kofta, a concoction of herbs that gives you some soothing. It opens your airways, but it doesn't deal with the throat cancer that's killing you, that has spread. Yeah. And I think that this immediate relief, you think, cancer agenze, oguntu gwatulya. This virus, corruption that comes entrenched with Museveni's rule, overreach, unaccountable, lack of accountability, cannot be taken care of by arresting someone in Bulambuli. It's a systemic issue. The entire system that engages both the executive and the judiciary and the legislature and the people. Taking out one or two or three pimples does not take care of the entire skin cancer. Kubanga akabalabe kamu kavuddeko, ensunda emu evuddeko, wavundavunda dda wenna. The rot is systemic. The entire body is eaten up. And so putting a bit of Vicks Kingo and feeling relief is what Balam and Namere are doing. And I think for me, therefore, that I'm not going to look for solutions from those who created the problem.
Well, thank you so much, Dr. Stella. Dr. Mirembe, in 30 seconds or 1 minute, can you respond to that? And then I'll invite Sentebe Bamutakude to tell us what his vision is, how people responded to the one lead majority, I guess, and his vision for Bulambuli, really. Dr. Mirembe.
Okay, thank you very much. I'll be very quick on the issue of Dr. Mulongo. That's why like Dr. Stella said, treating stage 4 cancer with, I don't know, Dr. Mulongo, I know him. Muhammad is a very dedicated worker, always pro-patient. He has actually been a leader of the Uganda Medical Association Elgon branch for some time. I think he retired last year. Very compassionate professional. So tying him in that kind of career for something he didn't have a hand actually in, and accusing him that he was supervising, I don't know. And we are making an effort actually to get for him bail, and actually the caravan is making sure that doesn't get bail. You know how the judicial has been compromised. We pray that actually succeed. Now, on the issue of, before I proceed, I want to welcome my clanmate, Uganda, Serwanjja, the chairman, Bamutakude, for me, all things of executive director, AIJ, I don't know them. All I know is that we won a place. And I want to thank him very much for taking intellectualism to the ground at the village level. That is very important. And I would encourage everyone who has got the resources, if you're working in town and you can move to the village once in a week or twice in a month, go and take up that village leadership and align it. Because successful leadership means you can form structures and get the structures to work for you. If you're a chairman, you don't have to be in the village every day. I'm sure that's what Serwanjja is going to push and illustrate with a lot of confidence and experience that he comes up with from the different areas where he has been leading as a top-notch leader, an effective journalist, among other things. So the federal system, one, in the current form that we are in as a country, Uganda, of course, these previous federal states have evolved. One of the evolution is that some have even been further divided into other minor states or minor units or tribes or something. But there are resources that are unique in each of these regions. There are those which have a lot of natural resources, gold and other things, that if they receive value addition, they would even beat you with your buildings and structures in Kampala. Each of these traditional states at least has a regional referral hospital currently. If we are talking about the healthcare system, and of course, the decentralization that has been documented on the healthcare system, with the supposedly every sub county is supposed to have a health center 3, every parish is supposed to have a health center 2, and of course the village with a community health worker who we have proposed to be actually at least a certificate nurse, though currently they are just health senior 4 dropouts level. So I think the federal system is still, if we have goodwill, good political will, and we have a honest conversation, we can still have it. We can have a roundtable discussion and honestly discuss every region, do an evaluation of the resources of every region. We can put a quota that, for example, in the next 30 years, 30% of the resources in Uganda, given it's already empowered enough, will go to this disempowered area. My discussion and conversation is about not about equality, is about equity. Get the short man to see what the tall man can see by using the abilities of the tall man, or putting a chiyinja bulungi nono omumpi ajja akole ki alabe where the tall man is seeing. So for me, my federal conversation is about an equity agenda for everyone in this thing called Uganda. So such that we then, after some time, decades of evolving and implementing the equity agenda, everyone later can actually be independent when they are empowered enough, when they are no longer malnourished in leadership, not malnourished structurally not malnourished in innovation, industrialization, and all that stuff. You see, every year we get a number of people who die from Karamoja because they are dying of food. But somehow, in the same setting, we have 2-year-old, 1-year-old, 5-year-old, 10-year-old children who are originally Karamojong, born in Karamoja, loitering on the streets of Kampala. Who enables them to get to Kampala? Who enables them to get to Kampala? That's the first question that we should ask. Who brings these vulnerable young people and drops them in Kampala? And they begin begging. And I usually move with eats in my car, particularly for that. But some of them have given them eats and they have refused them. They want money. Who has told them that actually, because if you came to beg and all you want is to eat, you will not refuse a bread. You will not refuse yellows. But some of them actually are not even begging to just eat. Someone is probably benefiting from the scheme. So he or she enables the transportation, dropping them here. Probably in an evening, that person collects from the very men and then he provides food to each of them. So I think researchers need to invest on that scheme of the children. Why are they Karamoja children in particular? Because 90% are from Karamoja. Why aren't they coming from Chigezi? Why aren't they coming from Ankole? Why not? Even here in Uganda, street kids who beg actually are very few. Like most of them are from one particular region. Why? Those are the questions that federal is going to answer. Equity-based federal. It will answer the infrastructure, the human resource for health, for human resource or skills development, the human capital development. That's what I meant to mean. Human capital development. It will answer the mindset shift to make people understand that you can actually be born in Karamoja and thrive, not even survive in Karamoja without moving to Kampala or to Abu Dhabi or Saudi Arabia. That will not happen when everyone has to first converge in Kampala. Kampala will not have the breadth it needs to attract more tourists to go and see the beautiful tourist attraction across this country. Tourism is another income generating activity, but people don't want even to land in Kampala. It is stinking. Potholes. It is full of thugs. Everywhere, even myself, I don't want to go through Kampala if I had a chance, but I don't have that luxury. So I have to continue. So we need to decongest this Kampala. Probably can get for the United Uganda, we can put the city somewhere at a central area, strategic security-wise protected. Another state can take Kampala. Actually, for me as a Uganda, I don't want the capital to be here. They can take it anywhere.
Dr. Stella, can you respond to that quick before the chairman comes in? Your rebuttal to that.
So,
Dr. Mirembe.
Thank you.
Dr. Mirembe, let's hear from Dr. Stella quickly before Setebe comes in.
So I mean, look, for me on the federal, the question of federal, like I said, I'm very conflicted. If I was to play devil's advocate, I'd say, trust the Buganda man to say, go and get your capital elsewhere. Kampala having been the capital for the last, I don't know how long, 100 years, But having said that, I was born in Jinja. I lived a long time in Kampala, but my father shifted to Masaka. And as a person who as a teenager, we lived in Masaka. When we came back from being refugees as children, we lived in Jinja, then Masaka. I love Kampala. I love Kampala city. There's life in Kampala city. Before I traveled and left Africa, I really did. I admired Kampala. Someone is laughing. Is someone laughing at me?
Laughing with you. Dr. Mirembe is laughing with you. Dr. Mirembe, mute yourself,
Yes.
please.
Hey,
How do you love Kampala in this current state? How?
Njagala nnyo Kampala. Let me tell you what I've lived in Germany and for a long time. I miss Kampala. I miss the life in Kampala. You won't believe it. I love Kampala. Even I lived in London. That's where I did my master's and my PhD. But I love Kampala. You won't believe it. So I'm one of the people who, yes, I've been to Jinja, I've been to Masaka, I've been to Mbale, I've been to Gulu, I've been around. But there's something about Kampala which you can't take away from us. And again, in terms of the federal question, when Solomon Serwanjja comes, I'm happy to yield the mic. But Buganda, we are so special. We have the countryside. Zedimunda Masaka. We have the countryside, beautiful countryside, Mpigi, Wakiso. We have the lake. Victoria, we have, it's amazing to be in the center. It's amazing. Our kingdom, Buganda, is endowed with so much. The rain when it comes, the equator when it passes, everything that's amazing in Uganda is in Buganda. And I say it proudly as a Muganda. We if it wasn't for this bad governance, this is heaven. The central region for me is heaven, whether it's Bamutakude or Mawokota or Singo or Butambala. We have heaven, and there's something about and maybe I say this as a villager. I'm a Muganda at heart. I'm a Muganda at core, and so the struggle around equity. You're speaking as a very tall man about delivering equity to the shorter people, and many times as a Muganda, I have to push myself to think about the Ugandan state, because sadly, until we get another alternative, we are very much centralized. We are very much post-colonial, neo-colonial creation of the colonizers. And unfortunately, even when you were speaking, Dr. Mirembe, you kept saying, in 10 years' time, if we build in 10 years' time, these other regions will have, these other federal states will reach us. We are ahead as a matter of colonial legacy. Everything beautiful is in Buganda, is in the federal states in the central region. And we can't change that history. Yes, we could build. If federal is going to be about equity or equality or whatever, we have to think about the other regions that would be part of the confederate, the entire federal Uganda. And it will need some thinking if one has to situate themselves outside the center and maybe outside Western Uganda, because I think relatively these two regions have been well built. Now, in terms of the LC1 chairman, that's where questions around modern day Ugandans, today's Ugandan, I think instead of centralizing, the important point I take from Dr. Mirembe's contribution is, instead of centralizing back to the colonial model, what would be interesting is, in terms of decentralizing before the federal state comes, before federation comes, we could begin already, as Solomon Serwanjja and others in his ilk have started, to say, I'm educated, I'm empowered, I can mobilize resources, I can mobilize governance, I can mobilize networks, I can mobilize leadership, I can mobilize all of these things. Instead of leaving it to the center to organize for us, that individual men and women who've been educated and have been traveled and have resources and skills take ownership of this reorganizing how governance is going to be done. It doesn't answer the question around healthcare, which needs a specific form of infrastructure and training and deployment and recruitment and revenue and monitoring and managing epidemics and managing pharmaceuticals and delivering them and doing all of that. But the question of taking governance back to the village is an important question that may allow us to meet halfway in terms of the federation question that if individual LC1 chairmen and chairwomen, chairpersons begin to take management and leadership and power away from the center, and we hold it in ourselves, in our village LC1s, maybe that's an alternative to the centralized government and the federal system, but there's something that's homegrown coming up. If we have 7,000 Solomon Serwanjjas, is that an alternative model in terms of governance? That's the question for.
And with that, I'm going to invite the Sentebe to share with us. Of course, Sentebe is still on his way to the airport. I can assure you he's not driving himself. But Dr. Stella, you do have support from Chris Namakola, who says that he tends to agree with you on the federal question. But he also questions if it's a stereotype. I think for me, the irony in suggesting that Uganda is so far ahead, I feel like that notion is
where are the best schools?
It's not just fine. Who is in those best schools right now? When you look at who is in those best schools, you have to interrogate that question a little bit further. Who is studying in those best schools? Where are the people?
Where are the biggest plantations?
Plantations. When you say plantations, what do you mean?
Coffee, matoke, cotton.
They were in Uganda, but those things have shifted. There's a lot of shifting that is going on
eucalyptus
right now.
trees.
Yeah,
I don't know what people are growing.
Yeah, there's a lot of shifting that is going on right now, but also who is benefiting in Uganda's so-called development or
where are the biggest barracks is?
Yeah, exactly. In Uganda.
Bombo, Chakasijagirwa, the biggest barracks are all in.
But someone could argue that that's occupation, not really development. But anyway, let us invite the Sentebe Bamuta Kude. First of all, congratulations on winning your election by one vote. You're going to tell us why you won by one vote, and if actually people accepted that election, or if you have been taken to court for a recount. If not, what is your vision for Bamuta Kude? Where do you start, and how do you insert in both the diaspora, but also how do you collaborate with the people like Dr. Mirembe to build a strong healthcare system from the ground up?
Thank you so much. Sorry, this program caught me when I was on the way to the airport, but I've just arrived. So you'll allow me talk while talking, walk while talking, and if with your permission I can switch off my camera and I keep talking. Oh,
for now you can switch off until you settle. Yeah, you can switch off while until you settle.
Thank you very much. Thanks for having me once again. I was here last week with you and Dr. Stella Nyanzi, and wow, we talked a lot of things. I want to first of all say thank you so much to you and Dr. Stella for supporting me, for cheering me on financially, emotionally. Eventually, we won the election. But what really stood out for me in the election is that elections are not won on the day of voting. Elections are won during the registration of voters. So what we saw was they brought over 50 people who are not from my village. They registered them on the voters register, and on the door voting, we see people we have never seen anywhere in the village. And we are like, Ate mwe musula kunjuzani. Where do you stay? Like, where do you stay? So there was a bit of chaos there. However, when the police was deployed, the police said, we follow the law. The question is, are they in the voters register? And the answer was yes. And they voted. So because of that, what happened was all the candidates were angry at what one of the candidates did to bring in people who did not stay in the village. And all of them coalesced behind me. You can imagine. So the NRM flag bearer went behind me. The two independent candidates also coalesced behind my line. And somehow we won the election by 1 vote. And so we've been really thinking, what can we do to really stop this vice of bringing people who don't stay in the village to vote? And I think that's the same thing that happens at national level. So one of my proposals, and I was with Biabakama on air on the front line, and I was telling him that as a village, we can maintain a resident register. Chairman used to write people who would be on his village. In the past, Nazikuno, we would, when you shift onto a village, you'd go to the chairman and they register you. Now, they don't do those things anymore. They actually don't. So you realize that the chairperson doesn't even know the people who stay on his village. So I was proposing that if we maintained a digital resident register, which is a place where the chairman, LC1, can register the villagers, and
I'm not sure if you are speaking, but we don't hear you anymore.
to the Electoral Commission.
Oh, you keep muting yourself.
Sorry,
Solomon.
guys, maybe you lost me. Can you hear me?
Yeah, now we
yeah?
hear you, but you had muted yourself earlier.
Oh, yeah. So, thank you. Can you just maybe, Dr. Stella, can you help me back me up a little bit as I go through security, please?
I know. Yeah, for sure. Okay.
I watched the I think it was NBS moderated by Simon Kagwanjala, where chairman was speaking about his experience, and I was shocked. I was actually very shocked because Biabakama did not challenge or deny or refuse or contest the fact that the registers for the village elections, the LC1 elections, get people who may not be residents. Biabakama did not challenge or contest or deny that. He actually recognized it as a problem. So did Kasule Lumumba, who was also present. And so did George Musisi, a legislator. So the Electoral Commission chair, the NRM minister, and an NUP legislator all agreed with Solomon Serwanjja, chairman, Bamtakude LC1 village. They all agreed with him that there is something that happens with that register. And what I was wondering is, if it's a commonly known problem, how come we don't have a solution? And so I think that when Solomon Serwanjja proposed to have the village ID cards, a brilliant idea. I think one of the responses from Odonga Oto, who is a legislator and a lawyer and now a political philosopher, his response to Solomon was, but we have to deal with the law. What does the law say about LC1 people giving cards to their village members, identity cards? And I think the other challenge which came up maybe from Biabakama or Odonga Oto was to say, then Solomon, you can, as well as chairman LC1, give identity cards to your family and friends and relatives, even if they're not residents. So yes, in a way, there's a potential solution such that village members will be able to be identified by their village ID cards. But because of the corruption that we have in the country, there was the counter around, what would bar an LC1 chairman from, recruiting again by giving out IDs to people who are not members of the village? And of course, there was the question of, what does the law say right now about village chairmen giving ID cards? Is Solomon back?
Don't you? No, not yet. It's going through a security right now. As you know,
Right.
the security process at the airport, especially in
Right.
Entebbe, might take him
Right.
a little bit before he comes back. But I want us to interrogate the idea of getting IDs from the village level and the counter arguments that come with not agreeing with that idea. And I think as I mean, today we are not supposed to be talking about federalism, but it has come up and it seems to be resolving the issue because
Blame Dr. Mirembe.
yeah, because if you're talking about identifying people, right? Understanding who lives in a village, it would be much easier if there's federated leadership, right? Because federated leadership also creates some sort of community policing. Community policing is knowing who is your neighbor, right? Who are your immediate 10 neighbors, 5 on the left and 5 on the right? Knowing those people, that helps with community policing, but also it helps with identifying who lives in the community and therefore who is eligible to be in that community or village register. And of course, the people in the diaspora could argue that when we have built houses in villages, we should also be eligible to be registered in those villages and be part of those villages in such a way that we are identified based on the developments we have created in those villages and therefore should have some sort of attachment to those villages. But I mean, Dr. Mirembe, your thoughts about that very idea, even before we delve into the healthcare or interns challenge or integration of medical interns in village systems, healthcare systems.
Yeah, actually, I think support actually the description that you have made. And I'm one of the believers that the destruction or destroying of the previous mode of raising children, whereby Omwana belong to the community, not an individual, is one other way that crime rate has gone so high. You live in a place with 100 houses, but even you don't know the detail of just your neighbors meters away. Because in one way or the other, they are constantly either migrating or yourself, you are constantly migrating. 3 months over here, the other year you are this side, and all that kind of cover. So you don't know who has bad intention in terms of criminality. You don't have an attachment to any place. You don't have an attachment to any area. You just a mover, a tourist in your own country. But even if you have 100 houses, we should know that actually A, B, C, D. Of course, with this kind of government we have, people are hesitant even to declare what they have because they feel they are paying a lot of taxes and not worth. But where citizens, where we could feel proud to have our money deducted and go into the federal government, a portion to the central government, I can tell you community policing is a needed tool or policy, only that if now applied by this government, it would become a source of operation because this government is an expert at getting very good policies and brutalizing them, vulgarizing them, vandalizing them, making them unbearable. But if we had a government that were for the people, community policing would be a policy that we should adopt. Every 10 houses actually 10 to 20 densely populated areas, because now with a dense population, crime rate is rising, but the people who are committing atrocities on us, we don't know them. And with social media, you talk to someone on social media and on phone, and you forget that actually you don't know them. You get it? So social media has also come in, and we are talking to people that actually we think we know, and actually we don't know them. So that's the one way that community is not developing, because if tugenda nga tupangisiza landlord amanyi n'ebintu bye. You get it? After all, the next day I'll shift to a better place. But if we develop that component of socialism, communism, I think it is communism, where we are responsible, we are liable for everything wherever we are. We have a responsibility. Then we shall reform our community back to a community that has a collective responsibility. Collective responsibility may spur collective development in all pivotal angles of that pillars that define society growth. And of course, when society is growing, it should grow with all of us. We cannot be equal. That's why me, I don't believe in equality, because we can't be equal. Some guy will be richer than you, or you will be richer than the guy. But all of us should be able to access social services equally. We should all be able to access those roads, those healthcare facilities, the education, internet prices. We should be able to afford all these other basics of life. After that level, then kati buli omu asobola okuyiiya n'asalawo climax ye. And for me, I think the better way to achieve that is federal system. And or if people don't want the word federal because they hate Uganda growing, they can find another word. But the components, the tenets of that should be about equity, should be about enabling communities at the grassroots to lead their own development at all pillars of society growth, society development, and in the new era of civilization in quotes. Because how can we say we are civilized society when our leaders are not civilized? Thank you.
Dr. Stella, you're going to have to respond to that.
I love this federal man. I love you. I love you. I love you. No, so I will. In Germany, Germany is a federal state. I lived in the wealthiest federal state, Munich or Bavaria, Bayern, for people who love football, for the first 3 years of my life when I was still a political exile before I became a refugee. And then, and it's affluent. We are the wealthiest federal state. And even in Germany, this issue of equity. So what you said, Dr. Mirembe, about we can never be equal. It's not possible, because even in Germany, Munich is amazing. The development is amazing. My kids went to private school. That the private schools specifically catering for all sorts of needs in Munich. The housing, the sort of support that's for foreigners and all of that. And then I decided to leave Munich because there are very many Ugandans, and I now live in Bochum, which is in the North Rhine-Westphalia region, and it's among the poorest. And the things I taken for granted in Munich, in Bayern, I don't have in where I live right now. And so, I mean, everything, we have trains, but this particular federal state where I live is a working class state. Their history is they had minerals, like huge iron cast minerals and industry. And so we have a lot of miners and mining families. And up to today, the culture is of miners. The attitude is of miners. You can't educate this working class mentality out of my city. We were the last to get a university. The university where I am now working is the youngest university in Germany, and it came last to my federal state. Education is not that valued, although people know Germany for having a very high education, status of attainment. Many young people here don't want to go to university because after high school, you go and work in a mine. But many of the mines have closed down, and also many of the industries have closed down, and we had outsourcing to the poorer Eastern European countries. That's where a lot of the factories and industries went to. And then there's China and India, etc., etc. So in terms of being a federal state that has a history of being Karamoja, very many resources, huge minerals. We have huge former factories that are now empty, because that's the infrastructure we had. But we get a revenue that, that we pay our own taxes, they go to the center and they're sent back to us. And in terms of the cut, because we still contribute very little to the central government, we still get very little back. And so the issue of equity is an important discussion to have. Even in Germany, we have not yet achieved equality for all federal states. But I think what I wanted to respond to, if Solomon is not yet here, is the question of the village IDs. And I think I in my village, in Masaka, in Chizungu, I have a village ID. So Chizungu and Masaka Twabasinga. My mom was involved in the LC1 system. Before Dr. Besige's FDC talked against the tax, we used to pay tax. I began paying this graduated tax. When I was 18, my mom said, it was very little money. And so we used to get that Musolo card as well as a village ID card. And the village ID cards would get a stamp every year to confirm that we have renewed our membership in the village. So one of my problems with that is there are men who have multiple homes, right? What happens to a man who has, my father had many homes as well, where polygamy is still the order of the day. What happens to their location in this village ID or village registration, if we're answering the question of the register, because he resides in all homes? When I began working, I maintained presence in my home in Chizungu. I got a home in Kampala. When I was at campus, I had a home there. So I could literally be in 3 village registers, right? Many people who work in Kampala, tulinya taxi ku Sunday, nene tuvayo ku Friday. There's that life of the commute to the city and then back to whatever village home. And so in terms of dealing with the question of double registers, or I forgot what the word is in terms of the
citizenry, double citizenry.
Okay, but what I'm talking about is the
village
register. How do you eliminate these people who are ferried in taxis? You're saying get them village IDs, register them. If that is the system, I can register in Bamutakude, register in Masaka, and register at Makerere, right? I can literally, we can work our corruption into this registration system. So I go and vote for Bamutakude and I vote in Chizungu and I vote in Makerere, and you do nothing because it's based on my residence.
Well, I think what I would say to that is that if we do have such scenarios, I don't see any problem with someone voting for their chairman LC1 in Bamutakude and also chairman LC1 in Makerere and also chairman LC1 in Kizungu. The only challenge, I think the only challenge would be if you live in all 3 areas, if you have homes in all 3 areas, the challenge would be in voting for president. Because the chairman, LC1s, they're different and they still serve your interests as a resident of Makerere, as a resident of Bamutakude, as a resident of Masaka, Chizungu, right? But the president is the same. So you can't vote for the president in all 3 villages. But I think it would be sufficient and it would be okay for a citizen who lives in 3 different areas to vote for those 3. We could also eliminate the idea of voting 3 times by creating barcodes on those cards that are interconnected. So if you have 3 IDs for 3 different villages, once you vote in Makerere, your barcode should indicate in Bamutakude that you have already voted somewhere else or in Chizungu, right? So that way you are not disadvantaging folks who.
So I think the barcode idea then is a brilliant idea. Henry are freezing. Henry, you're frozen. Ooh. Dr. Mirembe has Henry or freezing.
I think we have all frozen. I saw you freezing. I saw Dr. Mirembe freezing. I don't know. I don't know who's freezing. Is it me freezing or is it all of us freezing? Yeah, I'm here. Do you see me?
So just very quickly. So
I can hear you.
The barcode works very well. You've sort of dealt with a lot of the issues, but I think for me the more important problem I wanted to talk about was in response to Dr. Mirembe's suggestion around the current dispensation of surveillance, that we live in a military state where, especially for those of us who are critical of the government, I don't want my registration to be centralized anywhere, because when the drones come, twagala kumanya Mirembe wabeera. This
there
man,
was nowhere to find you. Yeah, that's
akasajja ka federo kaleeso wa federo mu busawo. We want to get him.
Exactly.
All you have to do is to go to his chairman and locate
Yeah, that's
him.
the issue.
And if, as Solomon says, he wants to digitize the village, one button, and I know who Mirembe, where he stays, what he owns, and I don't trust the current government with my details, with my location, with my PIN number. So Dr. Mirembe was talking about, we talk with people on mobile phones and internet, and we think we know them when we don't know them. You could be talking with spies. Actually, we live with spies in Uganda. That is how the drones find us. The drones don't come and make a mistake. By the time the drone gets to you, it knows who you are and where you are, and the GPS locator has been tracking you. So I don't want my village PIN to be put in a centralized space which Solomon Serwanjja or another LC1 chairman is controlling, because I don't know how my data will be used or abused. And it's not to say I'm a criminal like Okelo, the murderer of 4 baby children, but it's because the system we have to live with is a criminal system. But we moved away from the question of healthcare.
I know, and I want us to go back to that question as we wrap up, because I don't know when Solomon is going to join us. I think we can have a part 2 of this conversation.
Well, I think, I think we should wrap up.
Yeah, we should wrap up. We should wrap up, and then we can have this conversation later when Solomon is more settled, because we haven't had really his vision. I now have had snippets of what he wants to do as
Henry,
a leader.
I wanted to say something small. I have a lecture with my students, and it was supposed to start at 8. I've postponed it to 8:30, and I want to move to where I will teach from. So I pray that we can conclude.
Yeah,
and I can move.
Okay, conclude.
So, one, should I speak?
Yeah, you can speak. You can speak.
Okay. Yeah. One, our key issue today was maybe how the LC1 chairman can tap into and use their leadership to improve the face of healthcare in their areas, and of course to drive to a national picture of how the healthcare and leadership should look like. But I want to do my final remarks by saying is that
Well,
the
you don't have to
Ugandans,
do your final
Ugandans,
remarks yet, because I think we are going to come back to this conversation, because one of the panelists wasn't there, who was also really
okay,
vital in this conversation. So based on what we have
okay,
discussed so far,
basically,
just
just okay.
that's what you have and wrap up. Yeah.
So on what we have discussed, these are fluid like proposals and ideas that we cannot say they are casting in stone. For them to be applied, they need to be researched, conceptual frameworks and theoretical frameworks made, then piloted to see whether they can work, and then we can come to the actual agreement on what we can implement and what we can't implement. When you hear the stories that Dr. Stella has shared, I have a friend who's currently studying in Germany, and they has told me education that side in many of the states, federal states, is free, especially at the university level. And you can really study. Even foreigners, even himself is studying literally for free. So such a system is very inclusive, that a federal system maybe in Uganda would allow even Karamajongs to study from Uganda and vice versa. Because if it can allow Ugandan can study in German for free without getting a pre-qualified scholarship or special arrangement, that means that is a big system. So that means you can study that system, pick its best practices, and bring them and see whether they can be applied this side. Of course, not copy and paste. So, in summary, for us as a country to grow our healthcare system and the rest of the pivotal social services that are supposed to be provided by the state or by the government, we have to sit and have a conversation. I'll end with this example. I hate the fact that I have to drive a car every day to come to Kampala. If there was a public transport system that we are proud of, that is clean, that is ordered, I would proudly pay my little tax fare to town to work and pay little to go back. But you drive a car, you pay, you get, the fuel is very expensive. The traffic jam is too much, that you get late to work. The moment you wake up late by just 30 minutes, you are finished. The entire day is distorted. Network in the city. But is it there? The taxis which are there, you sit on the taxi, you live with the cockroaches and the bed bugs. Before you know, you are packed 7 in a seat which is supposed to be having 3 people. Before you know, the guy next to you, the other is in some other sort of situation. Before you know, like, I can't even finish my count of public. Henry, last month, I tried these taxis. I've taken so long without using taxis. I either use a border or a car. But I can tell you, it is very terrible. And our borders are also very terrible. They don't follow any rules. They are overspeeding somehow. They are scratching someone's car before they are slapping them. Chaos. So we need to reorganize our society. Being proud to be surviving or thriving in chaos is not really sustainable. And it starts from leadership. Leadership from the ground to the top. It is, I think, at that level where we are going to be even bold collectively enough to tell an errant leader off. Like you see, me, I admire the UK guys. a prime minister misbehaves, even if was elected or appointed 2 months ago, he will go, she will go. Here, someone is here for 40 years. Is happily enjoying raping us by the throat, raping us by the ears, raping us by all manner of open holes on our bodies, even the unopened ones. In a serious country, what happened to Besigye would steer the entire society to say no. Mwanga Chivumbi, abducted, beaten for 19 days. We have seen a video of Sam, I've forgotten his other name, the former PA.
Mugumya. Sam Mugumya.
I felt dying. I broke down. I'm like, what is this? Is it in my country? And the reality it is. And some government officials proudly associate with it. You get it? So we need to rebuild. We need to throw our intellectualism back to the ground. And that's why I supported Solomon Serwanjja. I even don't know where his village is, by the way. I learned where the village is after the election. But I supported him without him canvassing for myself. Why? He was implementing something I believe in. Okay? And let him go there, and we pray that he behaves and does the right things and sets a very good precedent such that more people follow him, such that the villagers can appreciate, he can orient them, change their mindset properly to the right mindset, and they applaud him. Then other people will flow in that line. And that's why I think we are going to need like 10 to 20 or plus years to change our society back to people who are proud of their societies, their country, people who can ask the hard question without fear of losing life, losing jobs like some of us, without fear of, this last month, elders are reaching out to me day and night. Mirembe, akaseera kano, sebo, tuketaaga bigambo bitono, yogera mpola mpola mutabani. It is very, by the way, very scary. Where? Very, very scary. And these are people you respect because they are anyway helping you even survive under this very turbulent time. So, thank you.
Well, thank you so much, Dr. Mirembe, for those thoughts. I think as we wrap up, Dr. Stella, respond to Dr. Mirembe, but also wrap up based on what we have discussed. To the viewers, we shall definitely return with the chairman, Serwanjja. Is going through security. Abatera okutambula mumanyi security bakiriza amasimu gakola. He had just reached the airport. Traffic jam where Uganda mumanyi, so he was traveling throughout the time that was supposed to be having this discussion, even though he had confirmed it earlier. Something urgent came up and he had to travel. But we shall try to bring him back to tell us his vision and also bring back Dr. Mirembe to see how we can, how medical interns or healthcare can be built from the ground up. Dr. Stella.
Just to thank you for organizing the space. I think my biggest take home from this space today was a statement that Dr. Mirembe said about two statements. One was about turning the ICU into a barracks. It was a very simple remark that he made, but it shows the status of our country, the state in which we are as a country. And he asked questions about who is accessing healthcare in that barracks. And I think the second thing that Dr. Mirembe said was when he was reminding us the broad definition of health, which is not just about absence of disease, but it's also about social, economic, political. He didn't say political, psychological as well. And he said that the judicial officer in the Kizza Besigye case is mentally sick. He's sick. Our country is sick. Our politicians are sick. And that's an important statement when we think about taking healthcare back to the first levels, whether it's community health workers at the health center one. I think for me, I want to think about diagnosis, taking diagnosis back to the very basic unit because of the politics we have in our country. We are a sick country. We're not sick because we have viruses or bacteria or germs in our bodies. We are sick because of the politics and the misgovernance issues of our country. And the sooner we find solutions, the better. And maybe to end on a note of saying, in terms of healthcare, that I noticed, I observed, I watched young intern doctors together with one of the former chairs of the Uganda Medical Association. I don't know if he's former or he's acting, Dr. Asime. I saw them protesting, and they went to the Ministry of Health and they had an engagement this week. And for me, the police did not stop them this time. The police allowed them to march from one gate down some street, and into another gate. And then I saw them sitting in meeting. And I think for me that healthcare issues are still there. They're still burning. And yes, Dr. Mirembe said we must find solutions to how to find, we must continue discussing about how to do the research. But I think some of the most pertinent gap that remains is how to solve the medical interns question, because if that is solved, we have one ready solution to to the healthcare problem we have. And I think that the solutions are possible, but we need to deal with that. It's still urgent. Thank you very much, Henry, for creating the space. And I will join the other space with Solomon, similar to Dr. Mirembe and yourself. I supported him. I didn't think we were going to win. And when we won by one vote, I nearly died because I was waiting for his opponent to challenge. He has the opening to challenge if there are below 50 votes between him and the next. But he hasn't challenged the result, so we celebrate. Thank you for organizing the space. Have a good week ahead.
Always a pleasure to have you folks. Thank you so much for joining us and for contributing constructively to this very important conversation. I think it's always a good idea for us to continue talking, even when most people think that it's not ideal at the moment, the moment, especially in regard to political conversations. But these are not merely political conversations. These are leadership conversations. We are engaging in understanding how we can build institutions from the ground up. And today's conversation reminds us that the strength of a nation is rarely determined only in parliament or cabinet. It is often determined much earlier in villages, schools, clinics, and communities. Medical interns should never carry the burden of building Uganda's healthcare system alone. Their work deserves fair compensation from the state. At the same time, stronger local institutions can play a meaningful role by mentoring future healthcare professionals, mobilizing community support, and helping create environments where young doctors choose to stay or serve, even if it includes engaging in a federal system conversation. I think when national institutions are under pressure, resilient local institutions become even more important. The same principle that sustain public trust in healthcare, fairness and accountability, dignity and service also strengthens the broader rule of law and democratic governance. So if Uganda is to build a healthier nation, the journey will not begin in Kampala. It won't begin at the legislature. Neither will it begin in ministry boardrooms. It will begin where every Ugandan story begins, at home, at the village level. one village, one community, and one generation at a time. Thank you so much for joining us today. My name is Henry Ssali, and this is the State of the Nation. God bless.
This is the State of the Nation. Rifa Mwanga. We are deliberate, we are reasonable, we are uncensored. The State of the Nation with Henry Ssali.